The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here today for the next episode of TMD Demystified. I am Tony Urbanek. If I sound a little hoarse today or rough, it's because I am just getting over a couple days of illness. I will survive, but I thought I'd just let you know that if it sounds rough, I apologize. It probably doesn't make a whole lot of difference to the viewers anyway. Today, my topic, actually, I'm enthusiastic about this topic also because it needs to be addressed. I've touched on all of these topics one way or another, but today's topic, I've touched on it in different areas, but the topic title is Critical Thinking in TMD. Let's talk about why I picked that topic, because when it comes to TMD, there is very little critical thinking going on, historically and presently. I stand by that. I can be corrected. I can, as always, I can be criticized, but that is a true statement, unfortunately. So we're going to unpack and dissect a little bit about critical thinking in general and how it applies to TMD specifically. Unfortunately, I fell into this rabbit hole years ago in my attempt to solve the problem of TMD, which no one really had a solution. And we did not only figured out what to do about it, but actually figured out what everyone else had missed. And I'm not going to even touch that again today. It's all over previous episodes and our course and the website. Or you can call me up and I'll tell you about it. But the point, and I'll use a good example today as to the lack of critical thinking regarding TMD, and it's all over dentistry. It's all over the profession. It's deeply embedded in the profession, and we have to extract it, just like you'd extract a tooth and throw it in the bucket at the corner of the room. Which reminds me, when I was a resident and intern at Vanderbilt in oral surgery, that was, who could make the loudest ping in the bucket, still in the stainless steel bucket in the corner of the room when you threw the tooth across the clinic room and hit the side of the bucket. Who could ring the bell loudest? Excuse me, but that just brought up a silly recurrence. All right, critical thinking. Let's start with the definition of critical thinking. It's not my definition. I just pulled it off the internet. I don't know who wrote this definition, but it's on the internet. I agree with it. I wouldn't disagree with it. Critical thinking is the intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and/or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to belief and action. So you don't have to rewind a bit. Let me just do it again. And again, I have been criticized in speaking engagements that I get too technical, and it's not what the viewer really wants. Well, okay, I admit, I'm a big proponent of getting patients what they need, not what they want, and that applies to education. If you want spoon-fed or just the sugar coating on stuff, you're in the wrong place. Let me repeat this, and this is really important, because when I give you the example of how this applies in current dentistry, some of you will agree, a few of you will disagree, most of you will actually be amazed in how pandemic it is, lack of critical thinking. So let's talk again about what is critical thinking. Critical thinking is the intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, and/or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to or toward belief and action. So basically, it's problem solving. It's part of problem solving. Critical thinking is part of problem solving. If you have a problem like TMD, you want to apply critical thinking to it. So critical thinking, and this is another way of approaching the same definition, different, much simpler concept. This is with a little sugar coating. So critical thinking is just asking why, how, when, which, and who, and observing for yourself. This is the key to critical thinking. The key is this word observation. Yourself. I mean, who is going to be doing the asking? Why, how, when, which, and who? Well, it needs to be the person critical thinking, and based on fact, not fiction. So the example I want to use in dentistry as it applies to TMD, and it's all over the place, and I hope I'm going to offend a few people, I guess. But the example is night guards. There is a huge, huge disability in the profession applying critical thinking to night guards. Night guards do not apply or affect TMD. Now, night guards have a purpose. Night guards protect the surfaces of the teeth. Night guards, if used, can keep you from cracking teeth. Absolutely. We talked extensively how we do not understand the mechanism of bruxism. There are theories out there. We know it has to do with the autonomic nervous system, the central nervous system, primarily modulated in the brainstem, but we don't hardly know anything about really anatomically, physiologically, what's going on about bruxism, except that stress and anxiety brings on bruxism. Bruxism is associated with stress and anxiety in about half the population. I don't know exact, but I would estimate half the population bruxes their teeth. Most of them are not aware they do it. But that's all we know about bruxism. It is related to stress and anxiety. The more stress and anxiety, the more bruxism. And it goes like any other bell curve. It goes from mild to average, mean, and extreme. And bruxism can cause damage to the teeth, and bruxism can cause damage to the temporomandibular joint if done enough for a long period of time. But the point is that night guards do not stop bruxism. And my main service is protect the surface of the teeth. And actually, when I prepared for this presentation today, it just so happened that I came across, and so not to criticize anybody out there who is routinely recommending and prescribing night guards for temporomandibular joint disease. We're going to pick on an online service that provides a night guard. It will go unnamed. You can look it up, probably find it right away, but I will for good purposes. So they don't try to sue me. It's like, truly, but this is if you Google night guards, make it yourself, or night guards made from home, you come up with multiple services that do this. And I just reviewed their online material, and sure enough, let's say a service, they send you a packet and you take PVS impressions of either upper, lower, or both. I assume you can do one or the other, maxillary or mandibular, or both, and make night guards to cover the surfaces of the maxillary mandibular teeth. And you send them their impressions, and they send you back some night guards. But in their promotion online, they quote decrease TMJ pain, decrease tension on the TMJ, and decrease frequency and intensity of nighttime clenching. Well, frankly, those are not true statements of a night guard, anybody's night guard. A prescribed night guard made in a dental lab, or a night guard made by a company that has a do-it-yourself, send you home set of impressions. Those are not true statements. And to take it one step further, I copied this off of, again, verbatim, off of their website a few minutes ago. I'm just going to read this to you. Additionally, by keeping your teeth apart during sleep, night guards can help to reduce tension in the jaw muscles that occur when clenching. This helps to prevent problems such as TMJ pain and headaches, which can be caused by clenching and grinding. Well, the only thing true about that is the last statement. TMJ pain and headaches can be caused by clenching or grinding, for sure, but night guards don't. And the reason is this, what we've discovered, which I talked about extensively. First of all, 90% of the loads on the temporomandibular joint are caused by occlusion on the posterior teeth. That is why you chew nuts with your posterior teeth. All of the significant hundreds and hundreds of pounds of force per square inch, or per square millimeter, if you will, are from the posterior teeth. And so a night guard, which does nothing more than cover the surfaces of all the teeth, does not allow you to take any loads off the temporomandibular joint. And I guess in theory, you can say the plastic cushions, maybe you can make that statement, whether it's hard or soft, but that it cushions somehow the tremendous hundreds or thousands of pounds per square inch, or thousands of pounds per square millimeter. It's not true. You are going to just pass the loads through that night guard onto the temporomandibular joint. And so you just got something else to chew on with your back teeth. You're not going to stop bruxing. Again, we covered, we don't understand the mechanism for bruxing. There is no on and off switch for bruxing. Half the population bruxes to one degree or another. You can identify people who brux with their history. Some of people will, yeah, I brux. And if you find significant amount of tori, maxillary palatal tori, mandibular lingual tori, or exostosis, usually lateral maxillary, but I've seen plenty of mandibular lateral posterior exostosis. A tori in the maxilla and mandible on the labial side is called an exostosis, not a tori, but they all come from the same thing. Significant forces on the teeth laterally pushing the tooth back and forth will subsequently, through the forces on the periosteum, lay down bone. Happens in the midline of the palate too. That's what a palatal torus is. But in the maxilla, mandible, on the labial, they're called exostosis. But if you see those, you're absolutely dead sure the patient is bruxism. Excuse me. Told you I'm not full speed today. I apologize again. All right, so we have brought to your attention the fact that this particular company is not being truthful and not giving you complete data. It's not complete data, and it's not truthful data. It's not supported by facts. So getting back to critical thinking now, it is important. It really is, especially when it comes to TMD, because it's a huge problem. We're not talking about, 1/10 of 1% of the population has this problem. Roughly 45% of females have temporomandibular joint symptoms. And of course, there are three major causes, or only causes, of TMD symptoms, which are bruxism, functional malocclusion, and trauma, acute trauma. But bruxism is primary. The most common cause of TMD is bruxism. And therefore, it's a huge problem. And dentists are faced with it all the time. And I have discussed over the years, starting back long before I got into the non-surgical treatment of TMD, long before, discussed with my dental colleagues, general dentists, as I worked my practice up, maxillofacial practice, through treating surgically the temporomandibular joint. We'd have discussions about non-surgical methods of treating TMD before we got into the surgical methods. But in those discussions, it was very clear to me that my general dental colleagues, 50%, wanted nothing to do with TMD. They didn't want to hear about it. They didn't want to know about it. They didn't want to treat it. They didn't want to see the patients for various reasons. Basically, they thought the patients were difficult. Some of them thought the patients were crazy. Some of them, they knew they didn't have an answer, and they were academically honest enough to go, I just don't know enough about it, don't want to know enough about it. I'll do other things that'll keep me busy. Those are the honest, compatriots, colleagues. And then there are 50% that made a night guard and gave it to the patient and said, here's your TMJ, here's your TMJ treatment, a night guard. So this isn't just something that just happens on the internet now, and having a company that do it your home impressions and make a night guard. It's been pandemic throughout the profession since I was a young dentist in dental school. And it hasn't changed significantly at all. And it is my goal and purpose to begin changing this. We will see how far and fast it goes, but that is my stated goal. And therefore, it's important that those listening apply critical thinking, not only to this issue, but it's a good thing to use in any problem solving you do. I can tell you that it really came to the forefront with me in my residency in oral maxillofacial surgery training at Vanderbilt. My mentor, David Hall, was a more than big proponent. He mandated critical thinking in determining services and how we went about our services at Vanderbilt in the oral maxillofacial surgery department. And he used that word, and I knew what he meant, and it was basically observing what you see. Actually, the word for that is obnosis. Looking at what you see, admitting what you see, evaluating yourself, not letting someone else evaluate for you. That's important. It's like you need to be, critically honest with yourself. Don't let someone else evaluate for you. Take a look for yourself. I apply that to what we do here. I challenge anyone to look at our data, to look at our study, to look at our experience, and apply critical thinking. So observation, this comes from the definition I just gave you. Observation, obnosis, looking at, seeing what is there to see, applying your own experience, not someone else's experience. What did you see when you did this or that? Reflecting upon it and reasoning it out for yourself. We're going to talk about reasoning in just a minute. And communication about it. Certainly you can communicate. For example, you can communicate with me. You can communicate. So how can you say that separating the posterior teeth takes the load off the joint? Well, there are studies out there. They're not my studies. There are multiple studies out there that have studied the forces on the anterior teeth, the canines, the incisors, and the posterior teeth in occlusion. And at least 90% of the loads on the temporal joint come to posterior teeth. Anterior teeth proprioception does not allow those kinds of forces on the incisors and canines. And then that leads you to a belief about a topic or to take action on whatever you're looking at. So it is important to reason through what you're looking at yourself. Now, there are two types of reasoning. There is, and this is where it gets a little, I've been criticized. It's like, why are you talking about how you reason a problem out? Because there's such a lack of reasoning when it comes to TMD. And it's not just, it just doesn't apply to night guards. Well, but it applies to surgeons, different kinds of surgery that has been applied, different modalities of treatment. In fact, the things that are done, I've mentioned them before, that just don't make any sense when you actually understand the problem. All right, so, but by the way, critical thinking isn't criticizing other people or criticizing a problem. It's not critical thinking. Critical thinking is all about reasoning. Critical thinking is all about coming up with a solution and a guide to your belief so that you can take action. So reasoning, there are two types of reasoning. There is deductive reasoning and inductive reasoning. Now, both of them are okay. Both of them are good ways to reason. I've discussed this briefly before. I'm not going to go too deeply into it, but most reasoning, just because most reasoning is deductive, that's what we're most familiar with. As scientists, as academicians, as providers in the medical industry and the dental industry, we are most used to using deductive reasoning. Now, deductive reasoning, simply stated, is you have facts in front of you, maybe 1,000 facts, maybe 10,000 facts. If you're looking at a topic and you research the literature, I mean, you can easily have 1,000 articles to read, and each article has several to hundreds of facts in them. And deductive reasoning is taking all of the facts that you've accumulated in your experience, reading, listening, going to lectures, taking all of those facts and trying to figure out which facts mesh and make sense, and excluding the facts that don't make sense. Well, to start with, if you're starting out with, let's just say 1,000 facts. I mean, you can see the complication of figuring out which facts actually mesh and come together and explain what you're looking at, and the facts that don't. That's a pretty complicated problem and overwhelming at times. But that is how the majority of science is done, deductive reasoning. And then everybody gets to put their hat in the ring, and they write an article, and they put their opinion, and they put their science and their statistical studies, etc. All of it good, all of it rational. It's a very difficult way to do it. And then there's inductive reasoning, where one way or another, you try it out and see whether it works. And when you find something works, then you have to figure out how it works, why it works, when it works, and that is described as inductive reasoning. You're inductively going and trying to figure out how this thing actually works. And that is how I came up literally, and my story goes all the way back to the first 24 patients that told me, first 12 out of 24, if I put my finger, my tongue, a pencil eraser between my front teeth, it feels better. That was it. And then I made a device that did that, and it worked. And that began my journey on inductive reasoning, in which I determined that I had to figure out how it worked, and I didn't know. But I had to use reasoning to figure it out. So there's reasoning in a deductive way, 1,000 or 10,000 or 100,000 facts that you're trying to figure out how they all mesh. Pretty difficult. And I think that's why TMD has been the lost cause in dentistry, as it's been for the past 60 or more years, because everyone is trying to apply deductive reasoning to this. And it just, I don't know why, I won't take credit for it. Inductive reasoning worked better, and it worked. And then I had to figure out how it worked. Well, that actually was not very difficult when you started going through the factors involved with, well, you're separating the back teeth, and inflammation is present in 100% of temporomandibular joint disease. I mean, 100%. All right, those two factors. And then the third factor that slipped into place is the autonomic nervous system organization and effect of inflammation in the temporomandibular joint, sending out signals from the central nervous system to tighten up the muscles, which explains the majority of TMJ symptoms. That is covered extensively in other episodes. So inductive reasoning. So if you're going to use critical thinking, you need to reason, and you can use deductive reasoning. It's fine. It's just more difficult. And inductive reasoning, as how we got here, how I got here, was applied to the problem of TMD. I think it's just lucky. I mean, I was communicating with my patients, actually looking for myself. Again, critical thinking. I was looking for myself. I quit reading the journals. I quit going to the lectures on TMD. I quit following the steps or the recommendations from other oral and maxillofacial surgeons or other dental providers. And I wanted to figure it out. And I started just by talking to the patients and listening. Critical thinking. So it is an intellectual discipline. Excuse me. It's an intellectual discipline. It's not hard. Just the word intellectual shouldn't scare you. It's just, disciplining yourself to actually look at the facts. Don't be swayed by what someone else says, and ask the questions to yourself or the person themselves, if necessary. Ask why, how, when, which, and who. To give you a better view of whether this is factual or just opinion. Now, just one other point about this area that I want to discuss. And just a statement, you may have heard this before, but I will reiterate it. Just because it's written or nowadays will include or video published doesn't make it true. Now, you all know that. I mean, you've been on the internet. Doesn't take a rocket science to know that a huge amount, sometimes I think 90%, but I don't want to be unkind. A huge amount of what you see on the internet is not true. It's just not true on whatever type of topic or venue you're looking at. So just because it's written or video published does not make it true. That is a fact. We all know that. On the other hand, there's another statement I'd like to make, and that is this: if it's not written, it isn't true. Now, these two statements are not contradictions. So if it's written, if it's not written, it's not true, is not a contradiction to the first statement. which is just because it isn't written doesn't make it true. The point being, and this goes with critical thinking, because most of our evaluation comes from, well, not a lot of it nowadays, what you see on the videos, one kind or another. But what you read is important. And it is a true statement that if someone who is wanting to make a point, wanting to make a statement, wanting to influence, for whatever reason, in this case, we're talking scientific influence, dental influence, patient treatment influence, they must be willing to write it down. If they're not willing to write it down, it's not true. And when they do write things down, then it can be critically evaluated. So it's important, just like, in conversations with your attorney, he will be the first to tell you, if you're writing a contract or reading a contract, if it isn't written, isn't true. They really don't want to hear anything about hearsay. They want to see it in writing. So if it's not in writing, it isn't true. But that does not make everything in writing true. It just means that you are willing to put it in writing and then let someone else who wishes to evaluate it critically. Let's give someone the opportunity to evaluate it critically. So I invite anyone listening, anyone who would like to become a network provider for the Urbanek device and protocol to apply critical thinking to other modalities of treatment for the temporomandibular joint, critical thinking for what I have discovered and what I have to teach, what you have to learn about this problem, which is not complicated. I've said that many, many times. What's going on here is not a complicated problem. And it's a shame that the dental industry, the dental schools have tried to make this a complicated problem. It's not complicated. So I encourage anyone to apply critical thinking to evaluating the Urbanek device and protocol. I'm open for debate. I'm open for criticism. I am mostly open for communication. So anyone wishing to evaluate this, there's several methods to do that. Of course, our website is a good place to start and get some information, www.tmjservices.net. I can be reached at Tony@tmjservices.net. Our Director of Marketing Education can be reached at Naomi@tmjservices.net. And we are open for discussion, especially critical thinking, because we know that we can prove what we say, and I'm willing to write it down. If you're not willing to write it down, then you're not certain enough about what you have to say. If it's not written, it's not true. I hope I haven't bored you. I hope I've made some points that will help you, not just in dentistry or in TMD. I hope as you evaluate other things in life, in your scientific life, your practical life, your practice life, your personal life, if you will apply critical thinking, you are a long way into getting a true and workable solution to the problem you're faced with. I say that sincerely. Critical thinking is very important. Extremely important. Enough for today. With that being said, I look forward to our next episode in a week. I have to tell you, I had to work pretty hard to get up the energy to do it today, but I wanted to do it. I had to make sure that I kept pace with the weekly episodes. I look forward to the next time I can speak with you. I do appreciate those who view these episodes on our podcast, TMD Demystified.